Thank you very much. Welcome back for this, the last afternoon of the conference. My name is Andy Kerr. I'm a Professor of Low Carbon and Climate Innovation here at the University of Edinburgh. And it's a great privilege for me to moderate this session because we've got four fantastic speakers looking at the whole notion of redesigning space and in particular around urban design for health. So we've got stories, we've got presentations from around the world. What I might do is just start with a few thoughts from a Scottish perspective before handing on to Michael Davis. From a Scotland perspective, we're an old country. We've got a series of cities, 7 cities with old central cores. We've then had extensive development since then in the post-war era, and we as a nation have both great wealth and great wealth production. I think we're the biggest wealth producers outside per capita outside London and the southeast of England, but we also have huge inequalities. We have very poor quality housing, we have excluded communities with very poor health outcomes. So one of the challenges from a Scottish perspective is how do we redesign living, thriving cities into this new era? How do we develop a new system to try and take forward some of these opportunities? And we understand increasingly the sort of health impacts, both the direct health impacts from which are directly attributable to air pollution, to water challenges, to noise, to traffic. But increasingly we're understanding some of the indirect issues around the need for green space, the need for social connections, the need for physical activities. So from my perspective, coming from a climate and an interest in how do you deliver zero carbon societies, how do you deliver thriving zero carbon societies, one of the challenges for us is how do we build cities that incorporate vehicles that have no petrol and diesel engines? How do we incorporate buildings that are zero carbon, that aren't burning and combusting material? So a lot of our interest has started from that end, but of course where we've intersected very directly is then with the wider health of the city and the health of the population within the city. So I just want to flag a couple of key points about Scotland. One is that we are very, very fortunate because we have extraordinary data sets and an ability to link different data sets, social, administrative data sets together. So it means you can start to look at the implications for people living, for example, a long way away from green spaces in cities. And you can start to understand the long-term health implications of where people live, their access to physical activity or to green space within cities, whether they're part of an excluded community. So this gives us a huge evidence, a treasure trove to actually shape public policy and public regulation. Secondly, within Edinburgh itself, we have a huge data network and Internet of Things being developed as part of a city deal, which includes, for example, 100,000 new sensors going in, looking at different environmental aspects across the city. So again, we have very, very high quality, real-time data which we can link to these long-term data sets. We also, in Scotland, have very, very ambitious targets for delivering climate outcomes around having no need for petrol and diesel cars from 2032, from having a third of domestic buildings, 2/3 of non-domestic buildings being zero carbon by 2032. In other words, moving very rapidly away just from gas central heating, from different forms of heating to deliver environmental outcomes. And so our interest then is how do we take all of these drivers and build new cities that are delivering vibrancy, social connectedness, physical activity, and a thriving economy within that context of a zero carbon city. So that's the interest that we're coming from, and we have huge opportunities being designed in through the planning system in Scotland to try and achieve that. But if that's the Scottish perspective, which is we kind of understand the issues now, the question is how do we operationalize it? Let's turn to 4 speakers who can talk a little bit from around the world on different aspects. And what I'm going to ask first is Michael Davis from UCL, Professor of Building Physics and Environment, to come and talk about health and the built environment. Michael.
Thank you very much for that introduction, and good afternoon, everybody. So yeah, I'm Mike Davis from University College London, and I'm just going to say a few words about issues relating to making cities, in particular, more healthy and sustainable places. And we've heard a lot this week already, I think, about the multiple challenges that we face, and in relation to cities, I've just listed a few of the health-related challenges here, just to get the session started. So there are multiple challenges at the city level, but also there are, as well as these local environmental challenges and imperatives, there are, of course, global imperatives, not least of which is the urgent and pressing need to reduce the carbon emissions of cities very dramatically, meaning very fundamental and transformative change in those cities. So if we have these multiple challenges, then are single focus policies appropriate to deal with these complex multiple challenges? And I just want to give an example, and just to start the conversation going this afternoon from the perspective of the UK. In the UK, a few years ago, the policy was introduced called the Green Deal. And this was a flagship policy which was intended to dramatically reduce the carbon emissions of the building stock in the UK, so addressing millions and millions of dwellings. And it meant really transformative change to dramatically reduce the carbon emissions of these dwellings. The policy really didn't succeed. It's now been withdrawn, and we've just done some work with the relevant government department to try and tease out reasons perhaps why the policy didn't succeed. I'm trying to avoid using the word fail, but I'll say didn't succeed, and how we can hopefully design a more appropriate policy or sets of policies which will address that goal. So that particular policy, the Green Deal, had I would argue, is a very single-focused type of policy which focused very much on energy efficiency and climate change. But in the work that we've done since then with a wide range of stakeholders, including the government departments, we've of course teased out, and here's just a few of these complex sets of interactions relating to the changes and the interventions in dwellings across these millions of dwellings that has impact on these other areas and is also impacted by these other areas. So that policy didn't explicitly address any of these other areas. So, for example, household crowding, land ownership, community connection, cohesion, etc. And all of these things are very important to people when they're making decisions, or potentially important when they're making decisions about their own homes. And it also didn't address issues such as at the top there, ventilation and indoor air pollution. In undertaking these energy efficiency interventions, whilst one would hope it would have some success with the primary objective of the policy, i.e. reducing carbon emissions, it will also almost inevitably impact on the indoor environmental quality. And it could have, as well as potential co-benefits of making those conditions better for health, it might also result in degraded indoor environmental quality with potentially quite significant public health disbenefits over those millions of dwellings. So we, I suppose, were rather convinced by the need then to bring this type of systems thinking approach to bear on problems such as this. And I think we've heard a lot about that during these few days. But in trying to think about what might be an appropriate set of resources or tools to work with policymakers, we started to have a look at what type of tools might already exist. And I don't know if you can see that there, but this is some work that we've just done recently. Helen Pinillo led this work as a systematic review of urban health indicator tools and how many tools. This is a chart of how many tools have been developed during this period. So on the left there, it's I think 1972, and it ends with 2016. And these are the number of tools that have been developed in these periods over that spectrum of time. So I suppose in one sense it's encouraging to see that there is this interest and there are research teams working on the development of these urban health indicator tools that could be used by cities to help inform better development of policy. But very importantly, the review seemed to demonstrate that the actual uptake and use of these tools was very limited. And Helen's carrying on this work to now do lots of work and interviews with relevant policymakers to try and tease out why, perhaps. But so we have this rather encouraging increase in the number of tools, if they are useful, but it seems that they're not being taken up by policymakers to the extent perhaps that the researchers would wish. So these were the type of issues that we wanted to try to start grappling with a little bit more. And we've just started, just a couple of months ago, a project with a magnificent title of CUSH, Complex Urban Systems for Sustainability and Health. And very grateful to welcome Trust for providing funding for this 4-year project, which, as I say, has just started. So I just wanted to give you a brief introduction to this and a couple of hopefully interesting snippets just to get the conversation started this afternoon. So the Cush team, we've brought together a large team. The top row there are actually 6 cities, which I'll just say a little bit more about in a second. And the other are teams of research organisations and other organisations that we've drawn from an international collection of organisations. So it's a very multidisciplinary team, again in the kind of spirit, I think, of the discussions that we've been having this week so far. So there are our partner cities. So we deliberately, I suppose, chose this matrix of cities to try and give us a useful contrast between high and low income and relatively large and relatively small cities in Europe, Africa, and in China. And so we've done some initial work with these cities in a short pilot project that preceded the main project. So I'll just give you a little bit of an indication of how some of that initial work has gone. So before I do that, just to, I suppose it's our thesis really that there are 3 main principles that we think would argue are essential in moving towards this really transformative action that's required in cities. So really fundamental change is required. And we would argue that there are 3 really kind of principal components to that at least. One is the provision of cutting-edge scientific evidence. But of course that provision of the scientific evidence alone is not enough. And we heard yesterday, I think, about how very often policy is made in the complete absence of scientific evidence. So simply producing that evidence will not be enough. And that's hence the second point, the need to work in a very participatory way with the relevant policymakers in cities to try to ensure that of course, that the research producing that evidence is relevant, but also that we can communicate effectively and appropriately with the relevant policymakers. And then also to, and vitally, we think, to make sure that this complex systems approach, that systems thinking, is embedded in all of our conversations right from the start with the various cities. And it's not really just working with those 6 cities. What we're trying to do in the project is to try and understand, are these components actually useful? You know, what might work in cities, and then to hopefully do some useful work in those 6 cities, but then to disseminate the work more widely via partners such as the C40 network of cities. I won't go through each item in this list, but in the pilot work that we've undertaken so far, it perhaps should have been obvious to us beforehand, but it became much clearer that from our menu, if you like, the items that we were perhaps able to offer to cities, that each of the cities has a preference for not for all of these points, and each city has a very different set of requirements. And so we're in the process of tailoring our work for each city at the moment and selecting a few of these bullet points to try to provide and to work with for the cities. And I'm just going to talk about a couple of the methods very briefly now, and how we're trying to combine them in a couple of the cities as a starting point to test out some of the work. So participatory system dynamics. So this relates back to that kind of map of the causal map of the connections between the components that I put up a few slides ago. So it's attempting then to provide a scoping, whole system perspective, so that at the beginning of the process we engage as many relevant stakeholders as possible to work in a very participatory way to start to map out the system and to try and understand what is within the system, which parts we maybe can address, which parts we don't have control over, but at least to try and get an understanding of that system in a very qualitative way to try and get an initial feel for connections and possible unintended consequences at that stage. It's a very participatory process, and its intention is to develop this shared understanding about problems and their causes. The quantitative modelling there, well, that feeds in via a process we're trialling in a couple of the cities at the moment, a microsimulation based approach, which many of you will be familiar with. So this is a very disaggregated approach, quite high spatial resolution, and we're able to do quite detailed modelling of the health impacts of a variety of different determinants of health, and then feed that back, if appropriate, to the whole systems model to try and, where appropriate, undertake some quantitative modelling so that various policies options can be tried out. Now, of course, there's great uncertainty in all of this, and part of the work is trying to assess, does this provide useful information to cities to enable them to develop hopefully better policies. So let's sort of give a couple of quick examples. The first example is the city of Rennes in northwestern France. I'm just going to go through this very quickly. They've just released their strategic plan, which is under public consultation for their carbon emission reduction plan. 50% reduction. They've expressed it in terms of 2010 levels and per capita by 2030. And they have 10 specific goals, which they're consulting on at the moment to enable them to achieve that. And I've just given the example of one goal there, in part relating back to my example of the housing previously, is to renovate 6,000 homes per year as compared to 1,500 homes per year that they're doing at the moment. And they think that will be extremely challenging, and they're already, I think, aware to a large extent of some of these possible unintended consequences as well as the co-benefits. So we've been doing some initial work with Rennes to really try to understand what the barriers and opportunities might be. So we've had several meetings with policymakers and a whole team of civil servants and other organisations in Rennes, and trying to understand how what type of decision and implementation support resources might be useful. And this combination of the system dynamics framework and the microsimulation model is one that we're going to try out in Rennes, and we've built the basis of a microsimulation model for Rennes now, and we've initially tested it with PM 2.5, understanding the health impacts of that at different at this type of spatial resolution within Rennes, and then we're going to begin layering into that microsimulation model other determinants of health related to, say, transport, housing, diet, etc. So we hope that this combination of a systems-based approach together with some quite detailed modelling, drawing upon the multidisciplinarity that's available in the team, will enable us to provide some hopefully quite rapid feedback on the consultation, which will take place during the coming year, and then to develop the model in more detail to work with Rennes on a continuing basis after that. The second and final example I'll give relates to Nairobi, and Kanyiva, actually on the panel, is involved in the Kush project as well from the team at APHRC, and we did an initial pilot work there looking at indoor air pollution in Nairobi's informal settlements. We worked following that process again of a systems-based approach combined with quite detailed modelling. So we engaged with over a series of workshops with a wide variety of stakeholders. Please don't worry about the detail in this. I can only say that it was much more complicated before we simplified it to this version. But I've simplified it one more step for you here, just to. So, as I say, please don't worry about the detail too much, but I just wanted to run through the components of what these causal maps look like. So this came as a result of the conversations we had in the workshops, try to understand what the priorities and issues were in Nairobi for this group of stakeholders and policymakers. So the items in green were the resultant types of policy or interventions that the group wanted to test via a set of different policy scenarios. The blue and the green relates to different feedback loops within the system that we've identified, and the red are the indicators relating to changes in the concentrations of PM 2.5 in these dwellings and the resultant health impacts. So acknowledging the uncertainty in doing so, we did some simulations, and the initial set produced some, and these are the different reductions in pollution in concentration of PM 2.5 as a result of different scenarios that the city have asked us to trial out, and there are of course associated health impacts that go alongside that. So we'll be going back to Kenya very shortly to work with the policymakers there to take this work further. So in summary, just to reiterate that we believe that these are the three kind of essential principles: the provision of cutting-edge scientific evidence within this participatory framework, and acknowledging the need to do this within a systems thinking type of approach. So we look forward to updating you on the project as it goes for the next few years, and thank you very much for your attention.
Thank you very much, Michael. We'll pick up some questions at the end when we've heard from the whole panel. Next up, great privilege to have Ana Diaz-Roux from Drexel University, Dean and Distinguished Professor of Epidemiology, to talk about making cities healthier, more equitable, and more environmentally friendly. Lessons from Latin America.
Thank you. Good afternoon. It's a pleasure to be here. I am here really representing a very large and dynamic team, the Salud Val team. We have a few representatives in the audience. raise your hand. There they are. So I'm going to share with you a little bit about our project and start out by maybe justifying, I think, just very, very briefly, why I think it's so critical to talk about urban health in the context of a planetary health meeting, tell you a little bit about our project, and specifically focus on built environment-related aspects, since this is the topic of the panel, but we also focused on a number of social environment-related aspects as well, tell you a little bit about activities and some preliminary results of special relevance to built environment and health, and if I have time, talk a little bit about future directions. So, 5 facts about urban health. The first fact, and you already know this, is that the future of humanity lies largely in cities, and this is true all over the world. The second fact is that the health implications of city living are variable and malleable. Urbanization is associated with increases in density, diversity of people living together, economic activity, social interactions. It can also increase pollution, sprawl, exposure to processed foods, marketing, overcrowding, violence. It also has implications for income and work, access to services, creativity, and the potential for urban policies to affect a whole bunch of people because they're all living close together. So the bottom line is that the effects can be positive or negative, and it's up to us in terms of how we organize and manage our cities to determine what directions they're going to take in terms of both health and environmental impacts. Now, the health consequences of city living are not the same for everybody who lives in a city, and this is just one example of data from the United States showing gradients in life expectancy by income across 4 different US cities, and just what I want to highlight is that if you're poor, it's different. It makes a difference what city you live in. And so cities can do things to reduce health inequities. And health in cities is driven by factors acting at multiple different levels, and this creates enormous opportunity for intervention at multiple levels as well. And last but not least, cities are doing things. They're doing things all the time for many, many different reasons, but we rarely evaluate the impact of these things on health or health equity. And so there are opportunities for evaluation and work with policymakers to understand the health and environmental impacts of the things that they're doing. This is just one example of an evaluation of this type. I'll talk about an example similar to this in a few minutes. So these 5 facts really motivated our study, the Salurbal study, Salud Urbana en America Latina, Urban Health in Latin America. This is a 5-year project funded by the Wellcome Trust, and it's coordinated by Drexel University, but we have 14 international partners, mostly in Latin America. And really we have a vision to create the evidence base needed to make Latin American cities, and we hope cities all over the world, healthier, more equitable, and environmentally sustainable, to engage policymakers and the public in a new way of thinking about the drivers of health in cities, and to create a platform that will allow continued learning into the future, beyond the end of this particular project. So we're really, we focus on multiple levels in integrating social, physical, biologic domains, multi-methods, systems perspective, similar to what Mike was saying, and engagement of policy actors throughout the project. I'm sorry this is a little bit tiny, but these are the institutions engaged in the project. As you can see, we cover a large proportion of the population of Latin America. And we really start by thinking about, well, what questions are most important to policymakers, and we have 3 aims. The first aim is to identify city and neighborhood drivers of health and health inequities among and within cities. The second aim is to evaluate the health and environmental inequity impacts of policies or interventions. The third aim, very much aligned with the project we just heard about, is to employ systems thinking and simulation to yield new insights into the plausible effects of policies, draw lessons, and then engage the scientific community and policymakers in a dialogue about these results. So I want to tell you a little bit about each of the aims. This is our first aim. Of course, the first big challenge is to identify, well, what do we mean by a city? And that is not easy. It sounds a lot easier than it is. We have gone through a process where we have identified 371 urban agglomerations that are sort of the universe in our study. And you can see that they vary in population quite a bit. I'm not going to get into the details of this. We actually have a poster on this. But basically, We have defined cities in 3 different ways. The first way is an administrative definition, which has the advantage of allowing us to link to easily available health data. The second is much more a data-driven definition that is about uses systematic methods to identify the built-up area of the city. The third is a metropolitan area definition, which is specific to each country and has to do with economic relations and commuting patterns. And then we also have sub-city level and also neighborhoods within cities. And so we're creating a data resource that has variables at each of these levels and links it to health data so that we can look at a whole bunch of different kinds of questions using a variety of methods. So what are some of the core built environment measures that we're most interested in? There are more than these, but I just want to highlight a few key ones. Of course, the size of city, their density, and how they've grown. Urban form, including the compactness of the city. Is it compact like round, or is it like a spider kind of spread out? The fragmentation, are there urban patches that are separated? Are these urban patches isolated from each other? Street connectivity, and transportation measures, bus rapid transit, which has been something that's very popular in Latin America, rails, bike lanes, travel delay, congestion, mass transit, and gasoline prices as well. So these are some examples. And I just want to show you some figures showing our cities right now, what they look like on these dimensions. This is just by country population size. Obviously, there's a lot of heterogeneity in the size of cities. This is very important because I think we want to focus not only on the big mega cities, but also on the smaller and emerging intermediate sized cities, because they have the opportunity to develop in ways that are more healthy and more environmentally sustainable. This shows how much these cities have grown over the past 5 years. According to city size now, and you can see there's a lot of heterogeneity as well in the rates at which cities have been growing. Population density is correlated with city size, but there's also variability within categories of city size. Compactness, also enormous heterogeneity within city sizes. Same for indicators of fragmentation and isolation. Connectivity, which is the street density of the cities, again, highly variable. As things like the length of the bus rapid transit system, now, which is correlated, as you might expect, with city size, but when we do it per capita, per million people, actually, the big cities don't look as good anymore, but there's still a lot of heterogeneity across cities. The same thing for bike lanes. And travel delay, congestion, which is a measure of how longer it takes to travel during peak commute times if you're in motorized vehicles. And again, lots of heterogeneity. Each one of those circles actually is the flag of one of our countries. So the bottom line is that there's substantial heterogeneity in built environment features across cities, and I think this is very important. So it raises some interesting questions. How do these features cluster? Are there distinct types of cities in terms of their built environments? What predicts being a type? What predicts built environment features? What political, economic, social conditions predict where a city lies? And last but not least, how do these features relate to environmental and health outcomes? And I would just want to show you a few examples of this latter question. This is very, very preliminary because we're just peeking at this data. This is hot off the press. Here's a first set of results looking at the relationship between some of these built environment features and mortality. And so we're looking at a universe of, as I said, almost 400 cities and mortality over several years, and looking at a number of different predictors. And unfortunately, this is a little bit small, but this shows the distribution across cities and countries of proportionate mortality, the percent of deaths that are due to different causes. This shows the communicable and maternal and neonatal mortality. So if you could see the numbers there, you would see that, yes, there is a lot of variability. About 70% of it is between countries. So countries are a big driver of differences in this kind of mortality. But if we look at violence, it's just the opposite. In fact, most of the heterogeneity is between cities within countries. And some of the other causes of death are in the middle. So the bottom line is that even within countries, there's a lot of variability in proportionate mortality. So this is a picture of our cities ordered by the percent of deaths that are communicable diseases at the top in red. And so you can see very large variability in the percent of deaths due to communicable maternal, neonatal, and nutritional causes. If we order by violent deaths, again, lots of variability. And the same thing for communicable, non-communicable diseases. So the next step, of course, is to see, well, are any of these built environment factors related to these patterns? And again, this is very, very preliminary, but we do see some interesting patterns. For example, both increases in city size are related to lower accidental injury deaths, and city growth, increased city growth is related to more accidental injury deaths. And then there are some emerging patterns as well, looking at some of these other built environment features like population density, fragmentation, intersection density, and mass transit in the directions that you might expect. But I think it's very interesting to see this demonstrating with data from nearly 400 cities. And so we're in the process of exploring these relationships in more detail and drawing some conclusions from these patterns. Another example that I wanted to show you linking built environment to health across Latin American cities has to do with this commute patterns and mental health. Is an example of looking not at mortality but a morbidity outcome. And these analyses, which were led by a team led by Cesar Wang, was trying to answer these two questions. Do individuals with longer commute times have higher probability of reporting depressive symptoms? And do individuals with longer traffic delay time during their commute have higher probability of reporting depressive symptoms? And so we're using data from a survey actually run by the Development Bank. We are actively partnering with many of development banks that work in the region for some of these analyses. And we linked this survey to some of these built environment measures that I just told you about. And one of them was the traffic delay. This is sort of the distribution of traffic delays across cities. But the bottom line is that the analysis showed that greater traffic delay was associated with higher depressive symptoms among the commuters, and that formal transit use was associated with lower depressive symptoms. This is after controlling for a number of factors. Of course, this is observational. There are some issues about causal inference here, but it's still very interesting to see, and this has been demonstrated in other studies, although not in contexts like Latin America, the relationship between the way we organize transportation and a health outcome like mental health. Our second aim is to evaluate health and environmental and equity impacts of policies and interventions. And we focus on 4 domains listed here: mobility and emissions control, social inclusion policies, comprehensive urban development, and promotion of healthy behaviors. And we do a bunch of different strategies to try to capitalize on opportunities to do evaluation. And the third strategy is strategic evaluation through additional data collection. And I'm going to show you one example of something that we're doing in this area, which relates to the Transmicable. This is an initiative, a public transport system that is being planned and will be implemented very soon in Bogotá, Colombia. And so, it will particularly provide transportation to a poor area of the city with high rates of poverty, violence, and social exclusion. And so this is a 3.5-kilometer public transportation initiative that will reduce commute time drastically, and also has a number of additional benefits associated with it. It's not just the transportation, but a number of other public service things that are going to be built along the transportation line. And so we are asking a number of questions about the impact of this new transportation initiative, which also on health, quality of life and well-being, physical activity, crime, travel time, a modal share, and choice of activity spaces in Bogotá. And so we're collecting data using a variety of approaches. We're measuring a number of different outcomes, including traffic-related crashes, particulate matter, and some health outcomes, and also looking at, in the longer term, things like mental illness and non-communicable disease. So I'm going to go quickly here because I don't have a lot of time. The project also has a qualitative component to get citizens to comment on how they perceive the impact of this and how they think this might operate and what the effects might be. The third aim, which I won't talk about much, has to do with systems modeling, very similar to what Mike was presenting earlier. We have done 3 participatory systems workshops to get stakeholders together to think about how the many different factors that connect transportation to health or food systems to health. And the last aim is about dissemination and policymaker engagement. And we're engaging stakeholders through a number of activities, through knowledge exchange workshops. We have one planned in Mexico in November where we're going to bring together a variety of policy actors and some members of the team to help shape the direction of the study since we're still early. Engagement with stakeholders and policymakers during the policy evaluation activities that I mentioned. Transmicable is a very close collaboration between the Universidad de los Andes, one of our partners, and the local policymaker community in Bogota. And also print and digital materials for policy outreach. And one example is briefs that we're putting together showcasing, because there are things we already know that are important to cities, so showcasing some of the things that Latin American cities have already done. This one focuses on sustainable transportation to share with the rest of the world some of the lessons and some of the experiences of Latin America. So here's our website if you want to learn more. You can learn more about our network and our project. And this is a picture of our team. So thank you very much.
Thanks very much, Anna. Next up, very pleased to have Kanyiva Muyundi, research scientist with the African Population and Health Research Center, talking about urban risk perspectives from Nairobi. Kanyiva.
Thank you. Good afternoon. I'm talking briefly about Nairobi in Kenya. I'm a person of few words, so I'm using pictures for the presentation. And for those who have been in Nairobi, you've noticed that it's a city, excuse me, it's a city with a lot of disparities and quite interesting developments. The city center, which is the first photo, looks very modern, but behind the scenes are places that I would say most of us rarely venture into, which are the slums, which you can see on the second picture, and high-end residential areas in the richer neighborhoods. And in between, where most of us live, is the photo on the bottom right of the screen. And there's a brief introduction to Nairobi city. It's a fast-growing city with a population that is now estimated at about 5 million, maybe give or take a few 100,000. And because of that fast development, we are not able to provide better housing, better transport, healthcare. There's quite a lot of issues that crop up, and they entail risk, or they put people's lives at risk. And I'm going to present just a few of the more visible risks that Nairobi residents face on an everyday. The first one that is quite visible for those who have traveled to Nairobi is traffic congestion. These are two major roads in Nairobi. On your left is the newly built Thika Road, which someone was talking about yesterday, whether it has improved the flow of traffic. But actually, we've noticed that we have more traffic on the 8 lanes that have been built. And so with that comes air pollution and loss to the economy. But as you can also see on the road to your left, people are actually walking on the road because there's no walkway, and that's a risk for traffic accidents, as well as more exposure to emissions from our vehicles. And of note is the age of our vehicles that are quite old. The average age of Kenyan vehicles is about 15 years, so with poor quality fuels and poor maintenance, then you can imagine the amount of emissions that people walking on the road have to deal with, and also the drivers and commuters in those vehicles. The second visible problem and challenge, which is a risk to health, is poor waste management. We rely on open dumping, where everything is mixed together. So in the Dandora dump site, which is quite a popular dump site, I think because of its environmental impacts, we have household plus industrial waste plus agricultural waste plus everything that the city is considering as waste. But of concern is what you can see here. There's livestock on the dump site, and that makes its way to our dinner tables, and the implication of what those animals are feeding on and how it impacts our health. And most of us are really quite oblivious to what is going on. Or we don't know where the beef that we are eating or the pork that we are eating comes from. If it's coming from the dump site, then I can imagine quite a lot of pollutants that have gone into those animals. You can also see human beings that are working on the dump site, and they face quite a lot of exposure. We've just closed a project where we were testing their blood and biological samples, and we are worried about exposure to hepatitis B for most of the workers, and it's something that we are going to be talking with the government as we disseminate the findings. The third most visible thing in the Nairobi landscape are slums, or what we call the unplanned or informal settlements. And I wouldn't say they are a risk per se, but it's the way we deal with the space, the way we interact with that space that is what we call the unplanned. The government wants to say that they're illegal, but the law says that people who have lived there are actually legal residents. And so we are caught in a space where we don't know how to deal with the slum. And we supply very little water to the slums formally. We supply very few amenities like social amenities and health facilities, schools. And as a risk to the urban health, we have had issues in Nairobi where we have outbreaks of cholera, just because the environment is not really conducive for human settlement. And by ignoring them or assuming that they are not our responsibility as a government, then we are actually telling the rest of the city that as you interact with them, you run a risk of getting an infectious disease. And we've also had experiences with the Ebola outbreak, was it in 2016, where some of the cases were actually originating from slums where the healthcare systems are quite poor. The most recent, and what every Kenyan is praying against, is rain. We are having quite a lot of flooding. And this is rising not because the rain is too much. Well, it's a lot. But I think it's our drainage systems that are not working as they should. We have poor storm water management systems, and most of it is actually channeled into the sewer system. And so most of the water on our streets when it rains and floods is really mixed with fecal waste, so there is a risk for infectious diseases as well. Then the next risk that we see for Nairobi, and which is not really visible to most of us, is poor quality buildings. Nairobi has been going through a boom of construction, and so because the city planning department is quite overstretched, they can't be everywhere at the same time, people are just taking shortcuts. And this was a building that collapsed in 2016 and killed quite a number of people, about 50 people, and injured over 100. And it woke us up somehow, and the National Construction Agency has been on its toes, looking at buildings that are looking like some shortcuts were taken, and marking them for demolition, so that we do not have future collapsing of buildings. But there are many buildings within the city that still, people living in them are not sure whether they will be coming down on them, or so it's a matter of wait and see for most tenants in Nairobi. And from those few slides, we can see that we are facing both natural and man-made hazards or risks, and urban planning is central to addressing this, but also including an element of education and awareness raising among residents, because I think we live in a city where we think some of the responsibilities are, okay, not some, most of the responsibilities are borne by those who are employed to do that work. But I think as a consumer, as a resident, we need to be aware that our actions are also putting us at risk and putting other people at risk. For example, if I take a car and drive, and I'm complaining about traffic congestion, I'm exposing someone else when I could have actually walked. Of course, there's no walkway, but there's a way we kind of deal with it. So I'm thinking some of these things need to be taken by residents as their personal challenge, so that when we are told, please leave your car at home so that the city is not congested, we don't complain. We can find a way of carpooling or doing something. And also for choice of houses, instead of looking at the rent and saying this is the cheapest, I think it's important for people as a consumer to be educated on the choices that they need to make and putting to task the landowners or the house owners to actually ensure that the building is done according to standards. Thank you.
Thank you very much. So our final speaker for this session is Diego Ramirez, a RISE design and engagement leader, who's going to talk about water-sensitive revitalization of urban informal settlements in Fiji and Indonesia.
Thank you very much. I'm delighted to be here, and particularly delighted to be speaking in probably the most beautiful space I'll ever speak in. I am an architect, so I had to mention this amazing space. So I'm here to talk about a project called RISE. And the RISE program aims to deliver a water-sensitive revitalization of urban informal settlements in Fiji and Indonesia. RISE is a large, multi-sectoral and locally led research program involving 6 countries and 18 institutions, including Monash University as a lead, Fiji National University, University of the South Pacific, Hasanuddin University, among many other partners. So I'm here representing a large interdisciplinary team, and with some colleagues here toward the front, with researchers from architecture, engineering, public health, medicine, science, ecology, etc. So very, very cross-disciplinary. Okay, so a little bit about the context of the project. So 1 billion people live in urban informal settlements. 2.3 billion people lack adequate sanitation, and over 580,000 children under 5 die of diarrhea each year. So our vision is to support partners to improve human, environmental, and ecological health in informal urban settlements across the developing world through a new approach to integrated water management. So conventional approaches are not always fit for purpose in urban informal settlements. Governments in developing countries settings often don't have the resources to supply trunk infrastructure to these informal settlements. And additionally, as a result of high density of urban settlements, wash solutions are not always appropriate in these contexts. So RISE is trying to complement these solutions. So the water-sensitive approach aims to achieve multiple co-benefits by providing protection from flooding hazards, improving public health through sanitation, improving environmental quality, diversifying water supply through stormwater, rainwater harvesting, and wastewater recycling, and providing alternative water supplies and effective multiple use of floodplains. So the water-sensitive revitalization is based on the provision of nature-based treatment systems or green technologies for sanitation management, which include new toilets and washing facilities. From this, the effluent goes to a reticulated collection system and then onto communal treatment tanks. From there into a system of constructed wetlands where the treated effluent can be safely discharged into the environment or used for purposes such as urban agriculture. So here we see the different elements coming together at a whole of settlement level of the intervention to include, again, stormwater wetlands, flood protection, subsurface wetlands to treat black water, toilet provision, and rainwater tanks. So some of the health context of slums. Diarrhea and pneumonia are two of the main worldwide killers of children under 5. Gastrointestinal infections are highly prevalent in informal settlements, where inadequate water supply, sanitation, and drainage in crowded environments leads to fecal contamination of soil and water. Some secondary effects of these include intestinal inflammation, stunted growth, and poor cognition. And minimal health research is performed in urban slums, but reports show worse child health in informal settlements than in poor rural areas within the same countries. So the research aim for RISE is to empirically test the impact of water-sensitive interventions on the environment, human health and well-being, and their interactions over the 5-year period. RISE is using a parallel cluster randomized controlled trial with stratified randomization of 24 informal settlements, 12 in the city of Suva in Fiji and 12 in Makassar in Indonesia. We will conduct environment and human health monitoring for all settlements for 24 months post-construction of the intervention to monitor and assess the effects on primary outcomes. There is an average of about 50 houses per settlement, totaling approximately 1,200 houses in the project. The study includes 7,000 participants, including 600 children under 5, so very large scale. In terms of the ecological environment, the intervention is expected to reduce environmental contamination of fecal waste, increase greenness and ecological biodiversity, and the program will provide continuous monitoring of temperature, humidity, and acoustics, and includes quarterly sampling of rats, mosquitoes, drinking and recreational waters, soil, and animal feces. In regard to human health and well-being, RISE proposes to change the physical and ecological environment, especially reduce exposure to fecal contamination, which is expected to reduce gastrointestinal infections. We hope it'll, of course, have a greater health impact on children under 5 and impact positively on well-being. The project also includes research on replicability and scale-up. We will identify drivers and barriers to policy support for effective interventions, develop policy analyses, including mapping of stakeholders, interests, influence, and potential for support, and develop policy frameworks with recommendations for engendering policy and financial support for this scale-up. So the project just started. It feels like a long time, but it started in August last year. And since then, we have done quite a few things. We have established local teams and RISE offices in both Suva and Makassar, with 30 staff now trained and operational. The site selection has been completed and communities have been mobilized. We have also completed enumeration in all 24 settlements. We have completed co-design with communities of 2 demonstration sites to pilot the process and test the interventions. And here we see a demonstration site in the city of Makassar, which, as you can see, suffers from very significant flooding. It also suffers from direct discharge of toilets into the environment, pit latrine saturation, open defecation, and unmaintained septic tanks. So the co-designed intervention provides a new elevated street for access and drainage, new house additions to include toilets, rainwater tanks, and washing facilities. It will also renovate and connect existing toilets to the green technologies, provide protection from flooding through flood walls, and treat black water through the use of communal collection and treatment tanks. With the help of the city of Makassar, we intend to also provide essential amenities such as streetlights, solid waste collection, benches, and some new trees. Human subject ethics have now been approved at Monash, Stanford, and in Indonesia and Fiji. and we have established the RISE labs from scratch, thanks to Matthew French's hard work and the big teams in country, in both Hasanuddin University and in Fiji National University, and have had extensive and continuous engagement with government for site selection and program planning. We have had continuous field training with the in-country teams in sample collection, and from here, we'll start house numbering and informed consent in a few days. Baseline is scheduled for Q3 of this year. Randomization into intervention and control settlements will start after baseline, and with the first wave of interventions planned for the first 12 settlements in 2019. So RISE is developing whole of settlement integrated responses which deal with water management and sanitation first and foremost, but also considers a number of significant issues which must be addressed in real-world action research of this nature, including livelihoods and subsistence, issues of gender, land tenure and ownership arrangements, a huge issue in informal settlements. Importantly, the project is developed through a significant process of community consultation and co-design, seeking long-term transformational change. Thank you.
Thanks very much, Diego. So we have about half an hour for a discussion and questions. What I'm going to do is ask those that want to ask a question to stick your hand up in a moment, and we'll bring up groups of 3 to the microphones to ask the questions. While you're thinking about that, though, I will just ask the panel a couple of questions off the back of their presentations. So we've heard 4 fascinating different projects covering different parts of the world. I suppose my question to all 4 of you, but particularly Michael, Anna, and Kenyeva, is about your sense of how sophisticated the response has been from cities to the data you are providing to them. In other words, I characterise Scotland as saying it's data rich. The cities know that there's an issue. The issue for them is how do you operationalise healthier cities. Michael, you flagged from Ren and from Nairobi, your sense of, are they at that sort of data gathering and awareness raising level? Are they actually at the sort of pilot project to use the data to see what works, or are they operationalizing? And perhaps, Anna, you can say the same about the Latin American cities, and Kenyeva, you can say that about Nairobi as well.
Thank you. Well, I think taking Ren first, they really have an abundance of data, I think, up to the point where the Deputy Mayor for Health, Charlotte Marchand-Fonke, I mean, she was really requesting from that menu that I showed up briefly there. So it's not, I think, data collection necessarily, but trying to make the best use of the data that is available. And I think they obviously are doing some analysis within the teams within REN, but I think trying to use that data in ways which can more usefully cut across the kind of silos within the teams in REN. And my sense is that's where REN is. I think in Nairobi, and I think Kenyeva is a better place than I am to speak about Nairobi. Do you want to say?
Thank you. For Nairobi, I would say we are at the pilot. Probably, if you'd classify it according to the complexity of data use, because most of our policies are really not driven by evidence. It's more of a political please the people statement kind of thing. Where they use data, it's quite limited. I think we've had successes with education only. For the Heidi's work that Mike talked about, we really had a lot of challenges getting data for the city. So I think the lack of data that is covering maybe a big span of time, and also the lack of awareness among policymakers that they need to use evidence to make their decisions, combines to make Nairobi or Kenyan decisions driven purely by just what someone feels like is the best. Yeah, so for example, I would give an example of when the new government came into power, we had free maternity healthcare just dictated by the president, just like that, without using any evidence on how that would impact on the service providers and the demand, the increased demand for free maternity healthcare. And so there was a lot of confusion in maternity hospitals because mothers were there and there were very few doctors. And so maternal deaths kind of migrated from home into the hospitals for the first few months, and until things stabilized. So we're in such a place where we are trying to push them to acknowledge that there's data that they can use, however limited it is, but it's a debate we are still going on with. Yes, thank you.
That's something we can come back to shortly, because I think that's a key point. Anna, your thoughts?
Well, I think what has been very interesting about our project is that, I think there have been very, very few examples of efforts to compile data across large numbers of cities in a way that cities can really be compared, even on simple dimensions. And I think that's incredibly powerful because it shows that cities are different. And if we can understand what makes them different and what makes some healthier than others or more health equitable than others or have less pollution than others, then we will learn a lot about what we can do. So in our experience, most of the data for Latin America, and I think this is true for a lot of the world, is country level data. It's not at the city level. And there's also the perception, there are lots of problems with the data. And it's true. But if you never start to use the data, it's never going to get better, right? And we have found that there's a lot that can be done with the data that there is. I mean, I showed you some patterns that I did a little quickly, but that figure of how the proportionate mortality varies across cities is just remarkable. I mean, these are 300 cities, and you have, the percent of people dying from violent deaths varies enormously across cities. And that's incredibly powerful information, I think. And we haven't shared results yet with a broader audience, because as I said, we've just been, this is really hot off the press, but anecdotally, people are starting to say, well, where's my city here, And I think that can be incredibly mobilizing, even for very simple descriptive analyses, just like, how are these cities growing? And these things are modifiable through policy. They're not natural things that we don't control. So I think that use of data, simple comparative data, can be incredibly mobilizing.
Thank you. Diego, I didn't ask you about that because you had written in co-design into what you were doing with that project. Can you just say a few words about what worked and what didn't in that space on co-designing it with the community?
Sure, thank you. I just had one small comment about data, because we've been talking about maybe metropolitan scale data, but then also when it needs to be operationalized on the ground in very, data poor environments, we really need to rethink how we do find new ways to collect data, and I think participatory processes are one such way. With new technologies, there's so much we can do, which is, leading to the community engagement and consultation processes. We've heard over the last couple of days in the conference how important it is for communities to not only be part of the intervention processes, but also really take ownership. In this case, I think it's particularly important because the green technologies, so the wetland systems and so on, really rely on communities to look after them. For example, if they are full of solid waste, they won't function. So for that, then we really need to, we've engaged in a significant process of community engagement. In Indonesia, I think there's very good frameworks for community engagement coming from government, effectively, where there's a government unit at neighborhood level, which I find really fascinating, and elected officials at neighborhood level and so on. So with Indonesian communities, it's been a really, really interesting process. Very open communities. In Fiji, the power dynamics are very different. The settlements often have a Turani Koro, as it's called, so community chief, who is usually an old male who will not necessarily allow everyone to speak or will really guide the conversation. So community consultation there is much more effective with women's groups separately or with youth groups separately or at household level. So that's, those lessons are really valuable just going forward because that's part and parcel of what we need to do.
Thank you. Okay, questions. Can you, if you have questions for the panel, could you stick your hand up and we'll, is there someone? Go on then. Okay, have you got any other, before you ask one, can we get any, 2 or 3? We'll get in a group. That's 2. One more question on that side. Great. Okay, if you keep your questions quite short, please. And we can't really see you, but
yeah, I can see
go
you.
for it.
Hi, my name is Federico Andrade. I'm from Colombia. I'm a student at the School of Population and Public Health in Vancouver. Thank you, everyone, for the very interesting insights. Gracias, Ana. I'm very looking forward for the results of your study. It's great to see that my city is there, and that's very powerful. And I'm also part of La Ciudad Verde, that is a collective in Colombia looking to bring sustainability and healthy to cities. And I just want to talk about the case in Bogota. Now I can see you, Ana. I just wanted to talk a little bit about the case in Bogota where the mayor decided that we were going to keep using diesel in the new buses, the BRT buses. And using kind of misleading data, not bad data, but just a misleading interpretation, they were supporting that. And citizens got together, and we got together with other collectives, and used art, used memes, used crowd science. We used a lot of techniques and actually persuaded a big change. And that happened fast. So even without the political will, there was a big change. And I think that this is very important. This is a good call for all of us that are in science to get together with these kinds of groups. So maybe if someone else wants to comment about how crowd science can bring us together to make things different. This was amazing. We got people in the buses measuring themselves, the levels of PM2, particular matter and things. So thank you.
That's great. Thank you very much. Yep.
Hi, I'm Natalia Linou from UNDP. I really enjoyed all of these presentations. A quick question on unintended consequences. A few of you referred to some potentially. One that has troubled me from the New York City experience is the potential for gentrification. The minute you invest heavily on green space and making a community better, the current residents get pushed out and richer ones move in. Is that a pattern, especially for Latin America, that you're worried about? Clearly, the projects on informal settlements face that less of a risk. But what are the political kind of land tenure kind of rights that we may be needing to think about in parallel? Thanks.
Thank you. And then the third question over here.
Yes, Jonathan Patz, University of Wisconsin. I was interested in Ana Diaz's aerial cable car, and it prompted me to mention that just coming from San Francisco and Silicon Valley, the speed of advancement in transportation, driverless cars, all sorts of transportation scenarios, are we in these projects anticipating how fast things may change in our projects and what all the health implications, both positive and negative, might be from the new age transportation?
Thank you for all those. Those are excellent. So one on crowd science, one on gentrification, and one on rapid technology advancement. Who would like to pick up any of those? The first, crowd science, sourcing crowd information.
So just picking up the question on unintended consequences, it was I think a question about gentrification, and particularly about Latin America, so I won't attempt it with regards to Latin America, but I think it's certainly an issue in London, for example, in some areas of London, and it does relate, I think, to some of that work that we looked at, these connections, for example, with even energy efficiency. So when you start to make these interventions to dwellings, you start to improve them, communities, it has impacts on local communities, and whether you call it gentrification, the communities can be dramatically impacted on that, given that it may be streets that have been done at the same time. So I think that's an important example of issues that need to be considered in policy making, which, as far as I'm aware, certainly in the UK at least, isn't, these different policies are not connected and can actually almost start to work against each other. And without the departments actually even talking to it, there is a need, I think, for some hub to enable those communications. And this is not a panacea, but we hope that this will start to. And in London, I know that the different departments now are, not as a result of what we did, but they've have a plan, and they're starting to enact that plan to have the different sectors talk to each other, and they actually now meet regularly in City Hall in London each week to discuss the integration between, say, the environment and housing policies and the health inequality strategies, which wasn't happening a few years ago. So I think these connections are happening, and I think that will help to at least highlight such potential unintended consequences. And one final thing, I think in London they're particularly aware of it. It's a different area, but the shift to diesel, done for perhaps very good carbon emission reasons, has had obviously the big unintended consequences of impacts on people's health with the contribution it makes to particulate concentration. So I think people are very aware of the possibility now of unintended consequences, and whilst one doesn't want to induce paralysis in decision making, I think trying to enable the best informed decisions, and that incorporates some awareness of these possible unintended consequences.
Anna, do you want to?
Yeah, I think these are three very good questions. I'll just comment briefly something on each of them. I don't know if I can answer them fully, but I think in terms of the potential for crowdsourced data is enormous, and it can work in many, many different ways. I think maybe a starting point to trigger that kind of data generation is to use the traditional data in ways that are mobilizing. And so people say, oh yeah, we have to measure more of this here because it looks like this. And so that triggers, and so then thinking about ways that we can capture that, I think, is incredibly valuable, and it is the future, really. There are really cool things also that can be done now, sort of with Google Street View and other systematic ways of capturing what these urban environments are like and how they change in response to things that we do, right? In terms of the gentrification question, yeah, I think that's the big, big challenge in many of the urban redevelopment initiatives that are going on in maybe many villas and informal settlements in Latin America. That's the big, big question. Are we just going to gentrify these places? And there's a big danger that that's going to happen. So I think the question is, how can those things be done in ways that don't take us down the path that has happened in so many US cities? So I think we have to be very vigilant of that and think about what things have to accompany the intervention so that it doesn't happen. That's critical. And to Jonathan's point, I think, these new things, yeah, we don't know what's going to come. I guess we'll have spaceships or something soon, like the Jetsons or something like that. But in the meantime, I think if we set in place data systems that allow us to track how health and environments are changing over time, in real time, that's the best way to monitor the impact of these things. So anything we can do to create these data systems that then are available for policy evaluation, we don't have to collect special data to do it. We have the data to do it because we can just do surveillance, right? So, and I think we're in a position now hopefully with all the new ways to compile and link and visualize data that we, if we really get our act together and work together to use the data for good purpose, that's what we can use all this rich data for, so that whatever comes down, we can evaluate it.
Okay. Kaniva, do you want to add anything?
Maybe briefly on the land tenure. And I think as Anna has said, it's one of the dicey things in interventions run, especially in the slums. And for Kenya, the experience has been that we had a very nice plan for slum upgrade, But because the government did not define who owns, they took they borrowed the land, if I can put it loosely, that they borrowed the land from the slum dwellers to build better houses, but there was no clear plan on who will get the newly built houses. And so communities actually went back to the government and said, we do not want your slum upgrading. We prefer our shacks because they belong to us. And we had to stop the slum upgrade. And up to now, we are still not sure whether it will continue. And a lot of money was wasted in that because at the end of the day, slum dwellers did not even get the units that were done. And people from outside actually moved into those houses, and the slum continued elsewhere. So it was not solving the problem. So I think land needs to be well addressed so that it doesn't raise the issues of exclusion. Yeah, thank you.
Thanks. Diego, any comments on that?
Yeah, just I guess a comment on the gentrification, and in particular, I mean, in informal settlements, I suppose one of the huge issues is around land ownership and turning what is informal land into formal land, and the processes of speculation that then follow. I suppose this brings to mind one of the reasons why interdisciplinarity is so important, because unless you deal with that through a policy system, it's going to be very hard to be able to deliver the intervention in a way that won't have these effects. I mean, we're talking about capitalism, and it's only, I suppose, natural. Just a small example of the difference between Fiji and Indonesia. In Indonesia, a lot of the informal settlements have gone through this process of formalizing the land, and residents own the private lots, and therefore there are mechanisms which the big funders use in order to stop speculation once interventions are delivered, but that's, I think that's a very tough thing to do. In Fiji, they have explored a number of different ownership types, including community leases. And in community leases, there is no private ownership. The community owns the land that the community sits on. And that allows for a whole range of new ways of thinking about development. And I think really what we need to do is think about different frameworks for land ownership that then lead to and are interconnected to interventions and therefore health outcomes. On the transport question quickly, I mean, again, a call for interdisciplinarity. The situation in Bogotá is a very difficult one, with these very, very high mountains and people having to travel by foot uphill for great distances. And it's very expensive to deliver solutions. In this case, a team of designers found an Austrian ski lift system that was delivered very cheaply in Austria. And sort of thinking outside the box and saying, well, why would you not deliver that here? It's perfect. But it wouldn't have come about if you were just thinking about traditional solutions, I suppose. So, yeah.
Good, thank you. Yes, I'm still waiting for perfect, clean transport systems in terms of lots of electric vehicles, but just so many of them on the road that they're just absolutely clogging the road with autonomous vehicles running around the city waiting to pick people up and take your journeys. But, okay, last couple of questions. One person's been waiting very patiently. Is there any other one just to finish as well? Can't see. Let's have your question first, please.
Yeah, well, thank you. I'm Charles Semugabo from Kerr University in Uganda. My question is about in low-income and middle-income countries, in most cases, social services tend to be concentrated in the cities. And so people freely move to the cities to access the services. In most cases, they do not want to go back. So there's that pressure on the cities to provide services to everyone coming in. And I don't know, especially that you have low and middle income cities in your projects. How are you trying to control for rural-urban migration in trying to see that the cities actually remain sustainable vis-a-vis the pressure that the population that moves from rural up to urban areas exerts to the cities. The second question is going to Kanyeva. I don't know to what extent politics is a risk factor to Nairobi, because where I come from in Kampala, the city is a political fighting ground for popularity, and so not so many decisions can be made towards building a sustainable city, and as such, we haven't made a lot of effort to move to building a better city because of political popularity that is, displayed in making decisions in the city. So I don't know to what extent it is a problem in Nairobi.
Okay, thank you. That's two quick questions. We've got one final one on this side, and then we will.
Hi, I'm Enrique from Brazil. I'm actually a family physician in a tiny little village, very rural village. And I wasn't going to ask this question, but the colleague there made the question about the rural migration. And Planetary Health has been discussing a lot about city design. And I just don't see much about rural discussion. And how would you, that's a big issue for family doctors, yeah.
Great, thank you. Okay, 3 questions. Who would like to pick those up? I don't have to pick all of them. But. So rural migration we picked up. Political decision making. Again, Kanyeva, you may want to pick that one up. And this issue about why aren't we addressing the rural as well as the urban?
I think, to the last question, I think obviously, in some ways, this distinction of urban-rural is very artificial, because there's this whole continuum of how people are living, which is not, they're in the city or they're not in this. There are all these intermediate places. I mean, we faced this when we were defining cities. Well, what do we mean exactly by the city? What is urban? Each country defines urban in a different way, actually, in national statistics. So I think we have to think about these things as integrated, and certainly cities must be seen as within the context of the surrounding rural areas that are supporting them in many ways, and vice versa. So I think broadening, it's not about one or the other. It's really about, recognizing that a very large proportion of the population lives in urban areas defined as high density or however we want to define them, but at the same time recognizing that there's really a continuity and that we really need to look at this in an integrated way is really important.
Just maybe a small comment on the issue, I suppose, of in particular thinking about the next decades of development and the urbanization, global urbanization patterns, and the problems of thinking of cities as somehow disconnected from the regional context that they sit in. And I think it's a really, often it's a very problematic language, and I think there are questions that your Anna's project is investigating, that in a sense it's cities rely on their regional context in order to survive, and vice versa. And the rhetoric about urbanization in cities is I think detrimental to policy, has a detrimental effects to policy and legislative frameworks for understanding the nexus between the two. I mean, our huge conversations about food production and where cities going to. Anyway, they're all things that we already know. Yeah.
Any other comments?
It's perhaps a connected point, but just that I think in our conversations with cities, because that's, I guess, what essentially this particular project is largely focusing on, but they're repeatedly, of course, making the point that there is only so much within their control, and there are policies that they can establish and try to implement within cities, but they're obviously very connected to what's going on just outside the cities, but also at a national level. So in these plans, and policy making, there are lots of assumptions, and that progress will also be made at a national level, and the city and national plans should coexist and work together, but that's obviously easier said than done, and another layer of complexity.
Yeah, certainly. Just from a Scottish perspective, we often think of it as 7 city-states that we operate out of, where it's essentially a city with a hinterland, with a region, and then there's this sort of ebb and flow of people in and out of the city as the economic attractor every day or every week. Even if overall the whole movement is towards the city, you still have this mass movement. So if you're thinking about a city and city health, you're actually also thinking about long-term movement of people in and out of cities, transport networks, and so on and so forth. So, you know, I think the terminology is important, that we don't forget that it is this broader context. So, thank you for listening. Could you please join me in thanking Michael, Ana Diaz, Caniva, and Diego for their contributions. It's been a fascinating series of projects around the world. And please show your thanks for their comments.